our uh, institutions like the Ithaca College to come up with this, to stand and say we're here. And I'm very happy that they are willing to do that. Um, Ideally, this physician's assistant program could provide the students or interns in their program that can serve the community and to supplement the need of all the for to meet the need our of our delivery system, health delivery system. Um, Ideally, this program would serve the community with the utmost care, respect, and consideration of the diverse cultures that exist in the community. One more thing, ideally, this program could make an effort to recruit students from the community so that they can, when they return to this community and serve. And I know that there's a lot of students within the community that are graduating from high school, college, and they're going into the registered nurse programs, and they can also, aim to be a physician's assistant or even to go to medical school. Personally, I think it is very hard. It was very hard for me, but I remember just an anecdote to tell you that when I was in college, we would go to the communities, to mostly churches, and take the blood pressure of the members of the church, and all we could do is just tell them that the blood pressure was high or normal, and to follow up with the doctors. And I remember a lot of those people, they had no doctors. They had no idea how to seek a doctor, how to, they had no insurance back then. We're talking about the 80s. And just by the grace of God, I guess, everybody seeks out service here and there. And I'm just happy to be a part of this program. If anything I can do to help, and we welcome the development of this entity in our neighborhood. Thank you, Liz. Thank you, everybody.
Thank you, Dr. Gilberto Rosales. I want to say that you've been in the community. We moved in this community about the same time. I'm not sure who came first before the other. But that was, some years ago. I came in this community in 1983. Yeah. And you built up your business out in San Fernando Valley. And still you kept the home here. Your family still lives here. You might have moved to a bigger home, but you're still here. Yes, so I want to say thanks. That's very important. Some people think that when I make it, as I'm getting more money and things are happening for me, I'm going to move up, and they move out. No good. Good.
I tried. I always, there's a movie that you guys can look up. It's called Doc Hollywood with I forget this young man. He has Parkinson's disease, but I always say this is what happened to me.
Yeah.
I went to medical school back east, and then came back. I grew up here in Koreatown, this in Jefferson Park, and then I said, oh, I'll probably go back and practice in Beverly Hills or something like that. But it didn't happen, and I'm here to serve the community, and it's been very, very rewarding, in many ways.
Yes, sir. Yes, sir. Thank you. Mm-hmm. Dr. Gilberto Rosales. And moving right along, Ana Merotra. Okay, am I saying your name correctly, Ana?
Yeah, you got it, Luis.
Okay, Ana heads a nonprofit. I got in touch with her, or she got in touch with me as a result of my reaching out and couldn't find anybody. I was looking for, how do we get involved with this wastewater system? How do we understand this whole thing? And so she contacted me and said, hey, I'm here. And what I do is help the communities across America understand how and why. This is a good position for you to take, Louis, and your community members who would like to know more and get involved. That's very, very important to resolving a lot of things concerning coronavirus. So now, Anna, would you please go ahead and share with us?
Sure, absolutely. Thank you for the opportunity. I really liked what Dr. Rosales said about the pandemic being a dress rehearsal. That is certainly the case for this tool that I'm going to talk to you about, which is a tool that can be used to track a wide range of health concerns, diseases in a community. So at a community level, which is what I understand is what you're trying to develop here. So what I want to talk to you about is wastewater surveillance. It has many different names: wastewater-based disease surveillance, wastewater-based epidemiology, but it's all the same thing. It's all about taking samples of untreated wastewater, so that it contains sewage that comes from your homes, and looking for health markers in that sewage. So mostly what I'm going to be talking about is looking for pathogen markers. So the virus, pieces of the virus that cause COVID, SARS-CoV-2, but I'm also going to be talking about a whole bunch of other pathogens that you can track using wastewater. And the way I wanted to frame this discussion is offer up 4 things you need to know about wastewater disease surveillance. So if you take nothing away from my talk, you'll remember these 4 things, hopefully. Okay, so here are the 4 things. Pretty easy. The first is that this is not a new tool. And I'm going to go into detail about each of these 4 things, I promise. The second is that it has been used for COVID in many places around the globe and in the US. The third is that it generates actionable data. And what I mean by that is it generates information that can be used by public health professionals, health departments, state, local health departments, to help make decisions. And I'm going to give you some examples of those. And the 4th thing to know is that wastewater surveillance is useful for more than just COVID. And I'll give you a lot of examples of that. Okay, so kind of digging into the first thing, the idea that this is not a new tool. So believe it or not, back in the late 1920s, so almost a century ago, some physicians collected untreated wastewater, so sewage samples in Dublin and Edinburgh, I believe, and looked for Salmonella typhi in that sewage and found it, and then published their results here in 1933, isolation of enteric bacilli from sewage. About 10 years later, in the US, again, a group of different physicians, they looked for polio virus in sewage. So in this country, polio was the first application for wastewater surveillance. And in fact, for nearly 100 years until the COVID pandemic, that was pretty much what wastewater surveillance was used for polio. And in particular, when the Global Polio Eradication Initiative was launched in 1988. Since then, wastewater surveillance has been one of the most important surveillance methods used by that group to figure out where polio persists in the world and where you can no longer find wild type polio circulating in a population. So it's been used in that regard since the late 80s. And Israel also set up a program in 1989 to track polio using sewage, and they continue to use it to this day. So it's not new, and it has many different names, like I said: sewage epidemiology, wastewater-based epidemiology, and then these down here. The reason that we tend to lean towards using wastewater surveillance, even though the term surveillance is not necessarily appealing, is because wastewater surveillance is just one example of many. There are many different tools that kind of fall under the umbrella of public health surveillance, which is really just tracking diseases and health states in a population. And it's just really important to do, because if you don't have a good public health surveillance infrastructure, you don't know what the health concerns are in a community. So that's why we tend to use the term wastewater surveillance, but it's not meant to mean that we can find any personally identifiable information in wastewater, or we can look at individuals' DNA and sort of invade people's privacy. That's not possible with wastewater surveillance. Here's just another example of how the interest in this topic has grown over time and really kind of exploded during the pandemic. So on the y-axis here is time. So starting in 1933, going to 2022. I didn't include results for 2023. And this is actually just the number of articles that you can find in the literature. I did this with a PubMed search using these terms down here just a couple weeks ago. And this little dot over here in 1933, that's the Salmonella typhi study that was published from Dublin and Edinburgh. And you kind of truck along. There are a few publications every year. And then things kind of tick up around 2000 when somebody said, hey, I think we might be able to find illicit drug, we might be able to track illicit drug use in wastewater. So people got really interested in that. And they kind of, interest got, increased. And then all of a sudden in 2020, when the first group out of the Netherlands, Gertjan Medema and his group discovered that, yes, in fact, you can detect and you can quantify SARS-CoV-2 RNA in wastewater, then the field just took off. Okay, so the second thing that I wanted you to remember was that this whole tool has been used for COVID in many places as part of this dress rehearsal, so to speak. And one way to look at this, the extent that it's been used globally, is to go to a dashboard that is maintained by the University of California, Merced, so not too far from where you all are. And it's called the COVID Poops dashboard. And I took this screenshot on April 1st, and you can see that each of these little colored dots, some of them are dashboards, some of them are just sites doing wastewater surveillance, that there are more than 4,000 sites cumulatively over the course of the pandemic that have used wastewater surveillance for tracking COVID specifically. You will see, of course, that it is mostly in higher income countries where these programs have been implemented. In lower and middle income countries, there hasn't been quite the uptake of it. It's also not, those programs are not publicized as widely, so they don't get picked up by the UC Merced group. But one of the things that the nonprofit I work for is trying to change is the use of wastewater surveillance and environmental surveillance in Africa. And there's a lot of tricks there to how to make it a usable tool when you don't have people who are connected to sewers, but that's not as relevant in the US. It's also been used very widely in the US during the COVID pandemic, and this is largely because of the establishment of something called the National Wastewater Surveillance System, which we pronounce as NEWS. So NEWS was established in September 2020. I remember feeling very impatient about getting it set up. I wasn't part of getting it set up. This is something that was set up by the CDC, but I remember writing an opinion piece in July of 2020 saying, we got to get going on this. We've shown that we can measure SARS-CoV-2 RNA in wastewater. Let's get going as a country on this. Little did I know that, the pandemic would persist into 2023. And so we had plenty of time to get up and running with this, right? But it was established in 2020. It was established by the CDC. It really should be thought of as a collection of local programs. So the CDC isn't going and taking the samples. Usually they're not analyzing the samples, but what they are doing is supporting the development of local programs. So these can be programs that are run by, local community health organizations. More often, they are run by state health departments, some county health departments, and some city health departments, like the city of Houston, the city of Chicago have very big wastewater surveillance programs. CDC supports these programs three ways. One, with funding. They fund health departments directly. They also fund a commercial lab to run analyses for sites that can't participate in